Hi, everyone. Welcome to Healing Horizons, where we share the latest news and research every week in trauma informed care, positive and adverse childhood experiences, and psychological safety. Brie, I just have to say, and to everyone tuning in live, my sister-in-law sent a video out of my nephew, and they're cooking together, and it's a little video, and he looks right at the camera and he goes, "Hi." And I was like, he could host a talk show.
Yes,
He's 2 years old. He's 2 years old. So he's ready. So I'm channeling my nephew today.
That is awesome. He's just like ready.
He's ready.
We can have a spin-off show that is just from the minds of little ones. And
Exactly.
I think everyone needs that like kind-hearted just joy in their life. So
Absolutely.
So I am Bree Twombly. I use she, her pronouns. And here at 10 Collective, we're really trying to help to create a world where we genuinely care for one another. We do encourage you to consider hiring us here at 10 for kind of partnership and implementing trauma-informed care and psychological safety kind of based programs and policies. So you can better care for your employees, and in turn, employees can provide better services and relationships to the families and communities that you are serving. You can check us out more on our LinkedIn page, as well as going to tend-collective.com and getting a sense of our services. And you can even take your own self-assessment now. That just launched. Did you go live this week? Is this week the first week that it's been on there, or was it on there last week?
No, it just went live 2 days ago. Yeah, so you're hearing it first. I'm Allison Sevilla, and if you head to our website, and we do need to launch this on LinkedIn, but we worked with a graphic designer, and it's a really, really beautiful wellness wheel that has 8 realms of wellness for employee wellness. So you can learn a little bit more about what makes a workplace healthy in these 8 different realms, take a little quiz, see how well you're doing, and share it with your colleagues. It could even be something that your company administers to figure out, different needs. And then it's something that we can help you with if you decide that you need some help in any of those 8 realms. So check it out. It's a free tool. We're really excited about it. So let's get into the news. So today's Thursday, June 27th, and June just flew right by. Yeah. So content advisory, we will be talking about trauma, which sometimes includes violence. Okay, starting out with our trauma-informed care news, which after we do this segment, you can go to our website, and we have posted a blog with the link to this video and a list of every single news item with the link to the article. So you can learn more about each item after today's segment. So the reason we share trauma-informed care intervention news is to give those of you who work in the field different ideas as to the interventions that you could be starting, and to give a little bit of insight into what we as experts and staff here at 10 Collective feel could be some of the limitations or strengths of the various interventions. So Senior Living Operator opens state's first elder abuse sanctuary, part of a growing network. So this is in Wilmington, Delaware. And it's called the Cuts Senior Living Campus, the state's first elder abuse sanctuary, and it opened on June 15th. So the Delaware shelter is partnering with Adult Protective Services and other elder abuse agencies in the state to provide services to older adults who are victims of physical, emotional, financial, and or sexual abuse, as well as those who have been neglected by their caregivers. Trauma-informed care of the elderly is not the sole mission of the sanctuary, Alderson said. We will also be providing community outreach and education on trauma-informed care and the signs and symptoms of elder abuse, how to prevent elder abuse, and what to do if you suspect or know an elderly person is a victim of elder abuse. So We love to see that they're incorporating trauma-informed care into something that's so important. Um, I have seen elder abuse happen before, and it is just absolutely heartbreaking when it happens. So this is wonderful to hear about. We love that it's a wraparound and holistic approach. So the shelters use a trauma-informed approach to provide holistic care and management and counseling, as well as medical, legal, and social services. So that is that wraparound when it's multiple different sectors and services. So again, as we say every time, we look forward to seeing evaluation of this program happen. It's not enough to just implement a trauma-informed care program. You have to evaluate it to see if it works. And so you have to say, what are we measuring? What is it that we would like to see get better? What are we defining as being abuse or not? And how are we measuring whether that's getting better over time based on this investment of funds? So we look forward and we hope that happens. Okay, U.S. Surgeon General declares gun violence a public health crisis. I'll say. Woo!
That isn't news.
Yeah. So then I'm like, should I laugh? Should I cry? I am laughing, everyone, to prevent myself from having a mental breakdown. Okay. The nation's top doctor called on policymakers to consider gun safety measures such as bans on assault weapons and high capacity ammunition magazines and universal background checks for all firearm purchases. His advisory also urges a significant increase in funding for research on gun injuries and deaths. Do we need more research? As well as greater access to mental health care and trauma-informed resources for people who have experienced firearm violence. Vivek Murthy, a physician, he's our Surgeon General, told KFF Health News that he hoped to convey the broader toll of gun violence on the nation and the need for urgent public health response. He cited soaring gun deaths among children and teens and noted that the mental health toll of firearm violence is far more profound and pervasive than many of us recognize. I wonder who he's talking about when he says that. Because I would say almost everyone I know absolutely understands that it's profound and pervasive. So I am curious the political connotations of who it is that he's trying to reach by doing this extra research. Because there's a whole segment of us that he does not need to convince. So guns are the leading cause of death for children and teens. I hate to hear that, with higher death rates among Black and Hispanic youths. So the National Education Association, in partnership with Everytown for Gun Safety Support Fund, released their school gun violence prevention guide that can help schools prevent, prepare for, respond to, and facilitate recovery from gun violence. So, we talk about this almost every episode. We don't know what's going to move the needle. I feel skeptical. I don't want to I don't want to be just such a bummer on today's episode, but I am feeling a little discouraged when it comes to this issue. So
we'll see. I agree with that. And I think this leads into our next kind of story that we're talking about, that's called Born from the Tragedy of Gun Violence. This program teaches children how to stop a wound from bleeding out. And just when I saw this headline, I was like, I don't even want to go anywhere near this article. I don't want to. After reading it, I have a lot of mixed feelings about this. So we'll share a little bit about it and then kind of talk about that. But as Allison just shared, firearms are the leading cause of death among people 18 and younger in the U.S. They account for nearly 19% of all childhood deaths. That's a huge number and very preventable number. So really just disturbing to see. So with this program, it's happening a lot within schools, as young as elementary aged children. It is trying to help to turn bystanders into immediate responders by teaching them to pack a wound and use a tourniquet. Within the program, they really try to keep the focus on safety instead of violence. So oftentimes, especially with younger kids, they're not talking about guns specifically or school shootings. They may talk about like if a parent is cooking in the kitchen and they cut themselves. So lots of different ways that they're kind of introducing it. And they really try to use developmentally appropriate language and examples with the kids. And so, as I said, I have a lot of mixed feelings around this. I think this could be a great skill to have for numerous different ways. You could be hiking and get hurt, or get hurt. Like there's lots, right, of examples could be. But the fact that we have to think about this and that we're putting this in school, in the article, someone is talking about how like now this is just as normal as doing like stop, drop, and roll for fire safety in schools. And like gun violence and responding to it when it has reached that level is just, we need actual change and reform in this country, because we keep having all of these things that are responsive to gun violence, because through policy and laws, nothing is changing. Right. And so people are trying to do things like this to be helpful, but we need preventative things to be put in place. So it just, I can't believe that this is like something that kids are having to learn in school.
It breaks my heart, breaks my whole soul. Yeah. Yep. Yeah. So
we'll move on a little bit now from talking about gun violence in America, not to anything that is any better than that necessarily. But so this one is called Police Department Creates Soft Interview Room. And soft interview room is in quotes, that's the name that they're giving it, to accommodate sexual assault survivors. So this is a police department in Missouri. They've debuted kind of the first soft interview room in the state to help to make sexual assault survivors feel more comfortable during the interview process. The police are saying that the soft rooms act as a critical component of trauma-informed care, allowing survivors to feel physically and emotionally safe. The Texas-based nonprofit organization Project Beloved and the Molly Jane Mission installed the soft care room. Instead of having kind of just a white room with a table in it, that is often where conversations and interviews are happening. The room now is carpeted. There's artwork on the walls. There's kind of softer lighting. There's comfortable chairs to sit in. So again, we've talked about this a few times over the last few weeks too, moving from like institutionalized feel to more of like how it would feel within like a home. And I like that, again, like we're thinking about this. What does it feel like, and what does that maybe contribute to the person who's there experiencing that environment? I'm not a fan of the term soft interview room. To me, that just, I don't know. It's not landing in the right way for me. I love that they're thinking about it and taking some steps to creating more safety.
Yeah, safe interview room. Well, yeah. Why can't we just have interview rooms? And why can't they all be kind to human beings?
Yeah.
Yeah.
I think to me, it's just like softness and like treating women who are the majority of like sexual abuse survivors with like soft gloved hands. Like there's something in there that just isn't.
I agree. I hear you completely.
Yeah.
All right. So this one is out of Australia. So Australian Research Council, which is ARC, linkage project to examine trauma-informed practices in public legal services. So researchers from the La Trobe Law School and the School of Allied Health, Human Services, and Sport have received an ARC linkage grant for their project on the use of trauma-informed practices in publicly funded legal services. Partnering with legal aid commissions in New South Wales, Victoria, and the Northern Territory, the research team will assess the impact. That's what we want to see right there every time. We want to see that funding going to assessing the impact of training, supervision, and coaching on legal service delivery. Wow. This just improved my mood. um, and for all of you who are wondering why this is such a huge thing, I literally woke up this morning feeling sick to my stomach about having worked at a government job previously, and someone gave a presentation while I was working there about how they spent millions of dollars to try and improve this health disparity outcome, and they actually made the outcome worse with the program. And I remember just being like, well, but does any like is does someone care? Are we going to do something different? What are we going to do about this? That's really bad. And I never got an answer. So it's actually my worst nightmare, to the point where I will wake up um with that on my mind. So that is why we love to see assessing the impact, evaluating the impact of these programs, especially if you're going to spend a lot of money on them. Okay. So this strategic research alliance promises significant community benefits by developing an evidence base for trauma-informed practices in the Australia legal system. Wow. That's what we want to see. We want to see evidence that it works and create that solid base, so that if you're going to implement trauma-informed practices, there is an evidence base. Wow, this is fantastic. Whoever did this, we applaud you. Okay, officers set up boxing club for vulnerable teenage girls. So a team of 3 officers are helping to change the lives of vulnerable young girls in Nottinghamshire through boxing. So assuming that is the UK. The club is open to girls aged between 12 and 18 that are currently in care or that are often reported missing to the police. The community initiative was set up after the police team noticed that a lot of the boxing clubs in the county were mostly made up of boys and didn't cater to the specific group. The initiative is designed to boost the self-esteem of young people and help them with their mental health and managing their emotions. Yeah, that's wonderful. It's always good to see kids being given the opportunity to do activities. This is another one of my soapbox issues. I really dislike children being given like therapeutic interventions. I'd rather them actually being active and doing something like an activity where they get to play or engage or learn, rather than necessarily like sitting down and having hard conversations about topics that I think should be for adults. That's just one of my particular things that I'm very passionate about. So this is the kind of thing that I really love to see. I feel a little skeptical about boxing. I actually had an ex partner who is a boxer, and he developed epilepsy as a result of participating in boxing for a number of years. And that is a real risk. And so when it comes to a developing brain, you do need to be really, really careful. But that being said, if it's something that they would be passionate about doing anyway, I think it's better than not doing it, as long as safety precautions are taken. But in my opinion, boxing is probably not a good activity for children.
Yeah, I had those same kind of mixed feelings about that one of like, ooh, like a great community intervention, like being able to be active, like work out some of those emotions, moving your body. But then also what we know just about the impact of the brain. And I think in the US, when we see the studies for like traumatic brain injuries and CTE within like football and hockey and some of those sports where there's a lot of contact with the head, definitely an important consideration.
Hopefully they're doing maybe like a not actually fighting each other, as children type of boxing or kickboxing hope, please.
Yes. Okay, the next is Mountain Home Montana getting closer to opening new facility. And so with this one, we will share the article and then we'll share the link to Mountain Home Montana, just so you can learn more about what is happening at the facility, because I read the article and I was like, oh, this is cool, but I want to know more of like what they do. So then I went to their website and was able to get a lot of that information. But what they're trying to do is to start a new center in Missoula in order to house 20 families. And so the organization started 25 years ago, really with the goal of helping families in need, and taking a kind of 2-generation approach. So making sure that there's kind of support for the adults, the caregivers, as well as for the children, and then supporting kind of their relationship and bonding as well. It's one of only 3 organizations in Montana providing a long-term residential housing program and a full suite of wraparound services for young mothers and their children facing homelessness. So they offer things like physical and mental health care, education, trauma-informed childcare, and additional services there. So that, again, is that wraparound of there's all of those different services located kind of in one location conveniently for the family. So they're not having barriers of transportation and having to go all over the place for the different types of services that may benefit their family. Mountain Home Montana really hopes to be able to provide mothers experiencing hardships the chance to start again within the new building. There was a quote from one of the moms who is in the program and said that she has gotten the ability to help herself by building relationships, which in turn helps her child. And I just really loved that quote because it is really showing that 2-generation approach there of she feels better and then she feels like she can be more responsive to her child. And I just think that, like, right, focus on relationships. We talk a lot about the protective nature of having those relationships. So this program really seems like they have a focus on how are we supporting positive childhood experiences for the children. And a lot of that starts with how are we supporting this caregiver, oftentimes with this program, this mother who is there so she can be the kind of parent that she wants and be able to kind of bond with the child. And the child care center, I did mention that that's trauma informed. And so they're really focusing on the social emotional development of the child. They have special training and infant mental health that is there kind of being provided. So some great things and hoping that they're going to be able to expand that program. I think they're waiting for some more funding with that.
And that's another key piece that we always say here, which is that if you evaluate your programs, you build in that evaluation period, you can use those positive evaluations to get more funding. So, if you're listening and you run some of these trauma-informed interventions, or you would like to implement them, that, building in that evaluation period is what helps make your intervention sustainable. So, can't skip that part, but we know a lot of nonprofits and agencies do. So, but it can really help with the sustainability.
Yep. Sustainability and funding. When you can show this leads to this, you can show the research around it. All of that is.
And we can help. If you want help with evaluation, we can do that. We would love to.
I love putting my evaluation hat on. It's one of my favorite things.
Me too.
In a different life, that's what I would want to be. Is an
absolutely.
The next article, speaking of evaluation and research, is called "Research Shouldn't Cause Trauma. Let's Find a Better Way." And I was like, yes, I love just that headline. I'm sold on that.
Yeah.
So really, it's this is a kind of like shorter kind of article, blog that was written, but really just talking about how when we're thinking about conducting research, when we're thinking about how we're disseminating research, we should always be trying to center the 6 principles of trauma-informed care. So an example, when we're thinking about that, using the principle of empowerment, voice, and choice, we want to involve the people on which the research is based and who it impacts. That's incredibly crucial. If you've been watching our kind of LinkedIn Lives the past few months, you'll know that we talk about that a lot too, making sure that it's the voice of the participants, those who have the lived experience that are really centered and have a role in actually shaping the decisions, what the programming looks like, and how it's disseminated as well. So just really liking that this is talking about we have to have that kind of critical intentional lens through every aspect. We're not just choosing a random question. We're not just going to say like, okay, here's the easiest way to do it. We're really thinking about the impact. Does this have the potential to be activating for people at any level? If it does, how can we try to like mitigate that? What are supports that we can have? And again, just centering those with lived experiences. So love to see that article.
Great. All right. Yeah, that's great. There's some good ones this week. There's always good ones. Okay. Kentucky distributes over $12 million in grant funds for opioid crisis response. So that's a really, really good chunk of money. And I have mixed thoughts. If you've been watching our show or listening to our show for a while, you know that I'm a person in recovery from substance use disorder. I'm actually 20 years this year in recovery, which is really exciting. Yeah, big milestone this year. It's it's on my mind quite a bit. And I have lost a lot of friends and family members to the opioid epidemic. So this is something that is near and dear to my heart. And when I see interventions for the opioid crisis, I typically will try to restrain my cynicism because, in my opinion, there are a lot of cultural factors in the United States that have led to this point that we're at, where we're seeing such great losses. And so oftentimes when I see money being thrown at the opioid epidemic, it feels like a Band-Aid to me. And the issues are so systemic. And actually, I have made some posts on LinkedIn that have gone viral in the past about how a lot of our culture in the United States has left young people feeling like they don't actually want to participate. And so if you're thinking, how can we help people recover? It's not about necessarily addressing the drug use itself. It's about making life more livable for people in America. And that is a really tough issue to try and solve. So whereas it's wonderful to see this amount of funding being thrown at this problem, it's actually such a small drop in the bucket when you look at like say wage theft by giant corporations in the United States that is contributing to, in my opinion, massive depression and other loneliness, depression, isolation, all of the deaths of despair, the drug use, is that we have created a very inequitable society in which people I always just say like who wants to work at like a Rite Aid with like flickering fluorescent lights for $12 an hour? Like, it's so dehumanizing. This is another soapbox thing for me. And so I wish that this money would go to making our society more equitable so that people actually have dignity when they enter the workforce. They actually feel empowered and like my job matters and I matter. If someone feels like they don't matter, drugs are going to feel amazing to them. So, Kentucky Attorney General Russell Coleman, I want to talk to you, Russell. I have things to say. Announced Thursday that 51 organizations across Kentucky were awarded this funding, and there are 51 awards. I want to highlight a couple of the prevention awards. So, Covington Partners supports prevention programming that includes out-of-school time programs, school-based health services mentoring, drug and violence prevention, and family engagement. See, I'm very skeptical of this. I don't think that's going to work. We have hard evidence that the DARE program to prevent drug use among children did not work. And that's what this looks like to me. So I don't like it. Girl Scouts of Kentucky Wilderness Road Council supports the launch of Building the Bridge to K-12 Girls Leadership Project, a community-based prevention program that focuses on increasing girls' positive childhood experiences. Okay, I like that. That's probably really good. I like anytime I see something that's community-based, that's helping people connect with each other, that is drug prevention right there. Legal Aid of the Bluegrass supports Project Renew, which provides legal support and wraparound services that help stabilize people in recovery by addressing employment barriers and other destabilizing civil legal issues. So I have mixed feelings. It's certainly needed, but having again been so personally embedded in this community and having known so many people with substance use and known them very well, the barriers to stable employment are significant. And they're often mental health related as well, to where, unless you can cure severe mental illness as a result of pretty severe childhood trauma, this person is not going to be able to keep a job very long. So, there's no Band-Aid you can put on that. There aren't even enough social workers in the world to help with that. So skeptical of that one. So, okay, 1 out of 3 of the preventative grants for me. So yeah, we do love to see the ones that have to do with positive childhood experiences and community building. So in my opinion, what we really, really, really need to be working on in America is taking the power away from corporations and empowering, regular everyday workers in America, and making society actually worth living and giving people dignity in the jobs that they do. So, and that includes universal health care, et cetera, et cetera, et cetera. And without those, everything else to prevent substance use disorder is just talk. Basically, it's just to say that you did something, but it's not going to help. So, and I say that both as someone with lived experience, as someone who's part of this community, have lost many loved ones, and as someone who reads public health data all day, every day. So, okay, next. The rooms in going hard today. Okay. The rooms in this British Columbia hospital were designed to accommodate ritual fires. Oh, I love this one.
This one's amazing.
So much. And I love that you gave this one to me, Bree, to read today. Bree sets these all up for us because my grandfather grew up on a reservation. So I love to see interventions that are culturally appropriate for Indigenous people in the Americas. So this British Columbia, so that's Canada, hospital was designed to accommodate ritual fires. Here's why. So Cowichan District Hospital, opening in 2026, it aims to establish a new model for culturally inclusive healthcare design. The hospital will be on Vancouver Island, where First Nations peoples make up 12% of the population. So over 2 years, ZGF and Parkin Architects met with representatives from the Cowichan tribes to learn more about what Indigenous peoples wanted from the hospital experience. The resulting project took these recommendations into account, including hiring more Indigenous staff. Love to hear it. Offering trauma-informed care and creating more inclusive spaces. Most significantly, the hospital rooms will support Indigenous healing customs on a scale not seen before. I just love this so much. I couldn't love it more. Okay, they'll accommodate ritual smudging or burning. And honestly, it just goes to show that it's not that hard. You can actually just sit down with people and ask them what they need and then build something that accommodates it. Mm-hmm. This is the practice. Yeah.
I just want to say, so in this, you're going to talk a little bit more about the rooms, but they were like, okay, let's create one room because that's kind of like standard. And then they were like, no, let's make it so any room could be that. So the person can be in their room. They don't have to be moved to like a different room. Yeah. And they figured out how to do it. Like, just because you go, oh, maybe that will be tricky. That seems to like be a roadblock and like prevent things. And they said, no, we're going to figure out how to do this.
Figure it out. Yeah.
And
just figure it out.
And yes, it's amazing.
Yeah. Because as many of you probably already know, the fact that Indigenous people in the Americas lost their entire culture and were forced to assimilate into European culture, lack of culture, has been so devastating. And there often really just isn't any context where they can practice their rituals whatsoever. And that leads to such a depletion on like a soul level for Indigenous people, and the various health outcomes that you look at are often the very worst on Indian reservations in the U.S. At least I don't know about Canada, and this is just wonderful to see. How can we center Indigenous culture? Yeah, wonderful. So these rooms will accommodate ritual smudging and burning, which is the practice of burning herbs or incense or having a small flame during times of illness and death. So in Canada today, healthcare policies require that at least one room in a hospital be equipped, but the new hospital boasts 185 rooms being able to support ritual smudging or burning. Wow. If someone dies in a hospital bedroom, First Nations teachings say that the person's spirit needs a way to escape into the environment. So wonderful.
Yeah, just everything about that. And I encourage you to like go click on the link and read more about that, because there's a lot more that they're being like really intentional about with the design of the building. Again, just making it so it doesn't feel like an institution. And I think with this one too, it's one of those things of trying to understand that there is a lot of like structural trauma, medical trauma, and that doesn't make you want to go use the medical system, go into a hospital. And so these conversations and changing what it feels like to go receive healthcare, what it looks like, are really important. So when I found that article, it just made my whole entire day. I was like, yes.
I feel better. I can go on. So thank you.
That one was just a really needed thing. So it looks like it won't be finished until 2026, and I want to like follow along. And then again, I hope they like are evaluating like the impact of it and all of that, so they can make sure that it really is kind of meeting the goals that they've set out.
But for me, it's already a success anytime that you can actually partner with community members and just listen.
Yes. And like in this one, you can tell it wasn't, oh, we sat down and we got feedback. It was, we sat down, this is what we heard. And like, it's happening.
Yeah.
And not on like this little, we checked the box scale, but like everything, it seems like, is trying to be informed and really center the voices. So amazing. Our next one is called Back to Bedside Grant, awarded to UConn Health Maternal Fetal Medicine Fellow. So the Accreditation Council for Graduate Medical Education has awarded Dr. Kristen Lee Moriarty Maternal Fetal Medicine Fellow at UConn Health with its Back to the Bedside Initiative grant. She was awarded the funding for her project entitled Bringing Residents, Fellows, and Nurses Back to the Bedside to Support a Mother's Road to Recovery, Interdisciplinary Trauma-Informed Care Curriculum for Perinatal Care. So she was really identifying that 1/3 of women experience some form of trauma during their pregnancy, and rates are actually increasing despite having lots of research and literature talking about the detrimental impact on patient outcomes. And then pregnant women with a history of trauma and adverse childhood experiences can have higher levels of pregnancy-related trauma, which can then end up kind of increasing anxiety, depression, and PTSD symptoms because of that prior history. So the goal of her project is really to improve recognition and management of pregnancy-related trauma while embodying a culture of mindfulness amongst OBGYN residents, fellows, and nurse trainees by developing a screening tool for patients and then conducting a one-day trauma-informed curriculum for residents, fellows, and nurse trainees that will improve bedside recognition of pregnancy-related trauma. She's trying to make sure that trauma-informed principles are implemented within that. And they'll engage in educational sessions, simulation, and mindfulness-based activities, all trying to kind of help improve the recognition and then responsiveness. with that. So I love that. Again, we've talked about this in the past too. If you are a birthing person and you experience trauma while giving birth, that can have a direct impact on your mental health, which then can have a direct impact on your ability to bond with your baby, and the baby's development and mental health. So how are we recognizing it? How are we saying this is something that is prevalent and common? And not just saying like, oh, that's just giving child, like that's just delivering a baby. That is what it
Right.
is.
Right.
Because it's not. So love to see that there's going to be some research and some action steps and then evaluation of what kind of her program looks like. So congratulations on receiving that award and looking forward to hearing more about that in the future.
Absolutely. Wonderful. And we had one on that last week as well. Yeah.
Yep. We will move into our kind of ACEs research now. So the first is the impact of childhood adversity on life course alcohol use patterns and health status among people living with HIV. This was in the Journal of AIDS and Behavior, June of this year. And the aim of the present study was really to examine if there were any associations between childhood adversity, which they considered ACEs, and then childhood economic hardship. And then a retrospective kind of look at lifetime drinking patterns and current health among adults who are in care living with HIV. They recruited people from an HIV outpatient clinic. They had 365 participants. The findings revealed that ACEs and childhood economic hardship have a significant impact on both lifetime drinking patterns and current health, particularly mental health. Intervening on alcohol use or misuse in the US must consider that alcohol is likely adopted as a maladaptive coping technique in response to early life economic hardship and social emotional stressors. The chronic stress over the life course can undermine the development of long-term healthy stress responses. And so I put that quote in from the article kind of in their findings and like recommended next steps for this, because again, we can look at kind of alcohol use, but what's below that, right? So like that's kind of what Allison was talking about earlier with like, we're just putting a Band-Aid on it. We're not looking at what is actually happening. What are those things and how do we address them that make people so they develop some of these coping techniques that are not as healthy as other ones, and why do they need to develop them in the first place? So thank you for that study. That quote, I was like, that is a good quote to have.
Absolutely. Absolutely. Okay. Barriers to and opportunities for advancing racial equity in cervical cancer screening in the United States. So, BMC Women's Health, June 2024. In the United States, racially minoritized people have higher rates of cervical cancer morbidity and mortality compared to white individuals as a result of racialized structural, social, economic, and healthcare inequities. However, cervical cancer screening guidelines are based on studies of predominantly white individuals and do not substantially discuss or address racialized cervical cancer inequities and their social determinants, including racism. So the researchers conducted in-depth interviews with healthcare providers. It looks like they interviewed 30 providers and key informants with expertise in health equity. They interviewed 18 of those. So most healthcare providers adopted a universal one-size-fits-all approach to cervical cancer screening with the stated goal of ensuring racial equality. Key informants overwhelmingly recommended that providers adopt an approach to cervical cancer screening and follow-up care that recognizes the role of racism in shaping racialized cervical cancer and related social inequities, is developed in partnership with racially minoritized communities. And, I don't think I've seen minoritized before. So that's interesting, right? Because it's like saying like, it's something that's put on people, right? You're not a minority, like you're like, well, minority just means a smaller percentage. Interesting. I haven't seen it written like that. Have you? Minoritized. Mm-hmm. You have.
Yep.
Okay. Or at least I haven't thought about it if I've seen it. Minoritized. Okay. And involves person-centered, structurally competent, and trauma-informed practices that address racially minoritized people's unique lived experiences in historical and social context. So this is an opportunity for culturally appropriate intervention that, where they actually listen to people and design something that works with the community a little better. So it's great that these researchers are looking at these racial inequities. Um, and so hopefully talking with people with lived experience, talking with people in the community to develop something that works for them. So great. Okay. More Than What You Eat, a review on the association between childhood maltreatment and elevated adult BMI, which is body mass index, which is the measurement typically used to assess obesity. So, Current Nutrition Reports, June 2024, a growing body of research demonstrates that there is a significant relationship between child maltreatment and adult obesity. So, we just want to say, again, I'm sure we've said it before, this is how the ACEs study was developed that was published in 1998. They were doing a weight loss study, and they found that the people in their cohort were able to lose weight, but then did put the weight back on. And when they started asking the subjects of their study about their childhoods, they found that child maltreatment was at the heart of the obesity issues that they were facing, which led them to develop the ACEs questionnaire that had 10 different stressful childhood experiences on it. And that's why we have the adverse childhood experiences field today. So, which, if you haven't read the original study, highly recommend it. And we have a link to it on our website. So in this narrative review, we summarize the existing work describing the different child maltreatment types: physical, sexual, emotional, verbal, and child neglect, and their relation to adult obesity, what is known about a potential dose-response relationship. So that's the amount of maltreatment in childhood and what that has to do with maybe how much overweight someone might be on a population level. Potential mediators and pathophysiology, comorbidities, and the preliminary work on gender and racial ethnic disparities. So found limited data on interventions that have been studied, and the impact of childhood adversity on obesity is poorly understood. That's interesting. Gathering data needs more research and should be done in a trauma-sensitive manner. So yeah, I would be curious to dig a little bit more into that one and see which studies they were reviewing. Since this area is like the basis of our entire field. So I'm just a little curious.
Yeah. And I think I'm looking at my note here, and I feel like my note that I wrote is confusing and being like, yay, screening. We want to see that. Which is not what my note is meant to say. But in this article, they were talking about how do you have conversations with people. So if obesity has been identified as a medical condition, how do you have? Is it just through questions and conversation? Is it using a structured screening tool that you're providing? What is that? And it says, we don't recommend any one of those methods, and they need to be studied and understood more about the impact that it could have. What is the process of delivery? How is that explained? So I loved that they were taking a critical lens and not just saying, we need to ask everyone and this is how to do it, but rather there's these different things, but we don't really have data on how effective they are, the impact that they can have. We just need to think of how are we doing it in a trauma sensitive way, and how does that show up? So that's what I liked about the screening discussion, not that it was
absolutely
saying anything about screening. Okay, our next this just came out this week, infant deaths after Texas's 2021 ban on abortion in early pregnancy. So this was in JAMA Pediatrics in June of 2024. And they were really trying to understand how Texas's ban on early abortions in 2021 impacted infant mortality in 2022. So there were 94,720 recorded infant deaths in Texas in 28 comparison states. And it found that the Texas abortion ban was associated with unexpected increases in infant and neonatal mortality in 2022. It found that the ban on abortion in early pregnancy was associated with unexpected increases in infant and neonatal deaths between 2021 and 2022. So congenital anomalies, which are the leading cause of infant death, also increased in Texas, but not in the rest of the US. So, right, if you're looking and there is a genetic or developmental reason why the baby may not be able to survive, often you could have a medical abortion for that. That was no longer allowed under this abortion ban. Well, that didn't increase in the rest of the US. It did in Texas, where they had that law. So the results suggested that restrictive abortion policies may have important unintended consequences in terms of trauma to families and medical cost as a result of increases in infant mortality. The study did not examine the effects of infant deaths on the health of mothers who were legally required to deliver dead babies to term, nor did it look at the mental health effects of carrying infants and delivering them, only to see them die. And it also raises, but does not tackle questions about the financial cost to families of carrying and delivering terminally ill newborns. So I think we're seeing here increased trauma for the families. In that, I mean, I would say, like, let's study these impacts, but it seems like the people who want these laws to be in there don't actually care about the impact that it has on mothers. So I don't know if that would actually serve anything besides potentially being re-traumatizing to these mothers. So what we thought, not unexpected,
Unexpected.
that, and makes me have lots of feelings.
Absolutely.
So,
Absolutely.
yeah. So moving on, gender differences in the association between adverse childhood experiences and premature mortality, a prospective population study. This was in Child Abuse and Neglect, July 2024. It's a representative Finnish population sample, including individuals aged 30 to 64 years. They were interviewed in 2000, and then they've registered their deaths until 2020. There were 4,981 participants, 2,624 of those were females. They completed a questionnaire. They included 11 questions on ACEs, and then questions on tobacco, smoking, alcohol abuse, self-reported health, insufficiency of income. So what they found was that of the ACEs that they looked at, financial difficulties, parental unemployment, and an individual's own chronic illness were associated with mortality. They found that a higher number of ACEs, so 4 or more ACEs, was significantly associated with all-cause mortality in females, but not in males, which suggested that factors like smoking tobacco had a higher impact on male mortality than only experiencing the ACE. So, right, they had a higher risk, and it was more of an association that they were smoking as a way to cope with the ACEs, but it was more of the smoking that led to their death rather than experiencing those stressful life experiences. And with women, it was just experiencing those stressful life experiences that led to the high mortality. And there's been other studies that have shown that females might be more vulnerable to the effects of experiencing multiple ACEs. It may have a bigger impact on our kind of biology. They found that poor health behavior, self-reported health, and low income were the major predictors of mortality in both genders. But when the effects of those factors were controlled, it all kind of led to childhood family conflicts that were associated with mortality in both genders. So really the findings of the study were just kind of highlighting the importance of a stable and emotionally supportive family environment in the development of children and adolescents, helping to influence their education, relationship formation, and mortality risk. So again, this is really just saying the importance of those relationships, and those other kind of positive childhood experiences that exist. But I thought it was interesting with kind of the gender differences, and I would love for them to continue to study and understand what's going on.
Absolutely. I mean, I was just posting on Instagram the other day about how I'm currently located in Istanbul, Turkey, and they smoke cigarettes here like no one I've ever seen in my travels around the world. And the Turkish people actually have a longer life expectancy than Americans, right? Which you would think, oh my gosh, I'm seeing all this smoking, I'm smelling all of the, I'm inhaling all of this smoke all the time, everywhere I go, and it seems that people are just smoking cigarette after cigarette after cigarette, like everybody, and yet they have a higher life expectancy than we have in the U.S. And I was looking at different factors that influence that, and one is just the focus on relational wellness in Turkey is much higher than in the United States. So that has really gotten me thinking. And one of the reasons why I feel that travel can be so beneficial, especially if you work in public health, to really feel what a culture feels like. And you can really feel here that, people really care about their relationships. In fact, I think a couple of weeks ago on Healing Horizons, I mentioned how I noticed that people here carry around little cute like portable tables that they set up at the park,
Mhm.
and they like
Mhm.
play backgammon or chess or like have a little picnic, and they just hang out and talk with their friends. So uh yeah, it's interesting. That's what this makes me think of. All right, final one for today. Psychological safety. So, 2024 Work in America survey. Psychological safety in the changing workplace. So, the American Psychological Society has put out this report. The Harris Poll conducted the survey online in the United States on behalf of the APA between March 25th and April 3rd of 2024 among more than 2,000 employed adults. Um, Workers who experience a high sense of psychological safety are much less likely than the average worker to characterize their workplace as somewhat or very toxic. While 15% of workers say their workplace is toxic, the overwhelming majority, 89% of this group, also reported experiencing lower psychological safety at work. So, well, I guess that's good that only 15% of workers said their workplace is toxic. But, I'd be curious to know what the criteria for that were. So, around 3 in 10 US workers reported that people in their organization who are not close to their age don't see the value in their ideas. 32%, that's really high, and feel self conscious about their age at work. 29%, a quarter said they are worried about their job security because of their age. Okay. American workers want control over where they do their work, whether it is fully in person, fully remote, or a hybrid of the two, and they're more satisfied when they have it. They may also want to work fewer days a week, fully endorsing a move to the 4-day work week. We would love to see that. Despite many workers reporting satisfaction with their work, individuals with a mental or physical disability were more likely to report experiencing toxic work environments and have more concerns about wages and inflation. So, workers who experience psychological safety in their workplaces tend to report much more positive experiences, including overall job satisfaction, relationships with colleagues, and fewer negative workplace outcomes such as emotional exhaustion and workplace burnout. Employers should review the workplace practices associated with higher psychological safety, such as opportunities to give and receive feedback, employing well-trained managers, appropriately involving employees in decision-making and goal setting, respect for time off, emphasizing skills over degrees, meeting free days and mental health days. And given the connection of psychological safety with ratings of performance and productivity, business leaders should consider that creating a work culture where team members can be themselves, speak up, and take risks can in turn impact the bottom line. Amen. So head over to 10-collective.com and take our employee wellness self-assessment. It's a beautiful tool. Will help you understand all the different factors. We've identified 8 realms with 5 factors in each. So that's 40 different items that your workplace could potentially address and see improvement on. And thank you so much for tuning into Healing Horizons. We did a whole hour this week, so thanks for sticking with us. And we will see you. We will not see you next week because next week is the 4th of July. So we will see you soon.